Hi guys, welcome to Dr. Emer's Instagram. So my name is Justin. I'm one of Dr. Emer's treatment coordinators, specifically for a lot of our male patients, which is why I'm getting on and talking about penis filler and penile enhancement and other things that can enhance your member. So who's excited about this? I know I am. I've talked about this a lot with a lot of current patients. I've talked a lot about it with my friends because everyone's really curious. So what better avenue than just to talk to a lot of people and kind of talk about the stigma behind men getting treatments? Because we all know women have been able to get breast augmentations. You know, there's less of a stigma of women going in to get work done. Well, now that technology has gotten a little bit better, fillers have gotten better. There's some better techniques, thanks to Dr. Emer out there, to where you can get some increased size with your penis. So there's already a lot of questions are coming in. Hello, guys. I'm so glad people are excited about this. But first things first, let me talk to you about the process that I go through with my patients. So there are 3 ways to really enhance the girth of your penis. So the first one, which is what I call kind of just sticking your foot in the pond, so to speak, is hyaluronic acid fillers. So if you've ever had anything to do with HA fillers, I'll just phrase it like that, you know that they can be used for many different things. So if you're using fillers in the face, you can get subtle lifting, you can get contour, you can get some volume. You know, fillers are fantastic, and I'm so glad they came out onto the aesthetic scene. Well, another way to use them is actually in the penis, and it's actually a really good way to increase the girth. So I know there's this whole discussion on what's more important. Is length more important? Is girth more important? Is the look more important? What are people going for? Well, I do think that one of the most important things is the girth of the penis, and that's really where the HA filler can come in. So it increases the girth. It also increases the size of your flaccid penis. If you want to be more of a quote-unquote shower and not a grower, it's a good reason to do fillers. Now, a lot of people are saying what is a permanent option? How long do these fillers last? So HA fillers, they're made of hyaluronic acid, and that's something that's naturally found in the body. That goes away in about 7 to 8 months in the average male. So males tend to have faster metabolism. If you work out a lot, if you have an active lifestyle, those fillers aren't going to last as long. However, the best part about these HA fillers is that they're not permanent. So this is a good way to kind of step into the water of penile enhancement, and you don't have to worry about, well, if I don't like the results, do I have to keep it? No, that filler is going to go away. So it's a really good way. However, if you like the results, then there is more of a semi-permanent solution to this, and it's called Bellafill. Now, how many of you have actually heard of Bellafill? I'm going to read the comments here. Bellafill, and if you watch Dr. Emer's Instagram, you know a ton about Bellafill. He uses it a lot for male jawline enhancement, which is actually something I want to do. He uses it in acne scarring to help rebuild the volume, to have more of a permanent result. Well, we can do the same thing with the penis. So if you are interested in Bellafill, there are some people that are allergic to Bellafill, which is unfortunate. However, ever since I started working for Dr. Emer, I think I've had maybe 2 patients that have actually been allergic to Bellafill. But what you do is you go to any Bellafill provider. You can even come to our office. We'll do a little Bellafill skin test, and that will let us know in about 48 hours if you're allergic to it. Now, like I said, I only had 2 patients ever allergic to it, so the good news is most of you probably aren't. So this is made up of PMMA microspheres. That's what makes the Bellafill semi-permanent, so it can last up to about 10 years, and in some patients it's even lasted longer. So one question before I kind of dive really deep into the many ways that you can enhance your penis is a lot of people are worried of, is it going to change the way that it feels? Is it going to change the way that it feels with your partner? Is it going to look like it's been enlarged? What kind of goes into this process? So with the HA fillers, we tend to use fillers that are right in the middle. So it's not going to be a soft filler, as I say, kind of like Vobella or anything like that. It is going to be more of a firmer filler. So your penis is going to feel natural if it's flaccid. It's also going to feel natural when you're erect. Oh, well, thanks. Sorry, I just got a nice comment. Thank you so much. But determining on what you want and what you need, we can determine which HA filler will be the best for you. Because there are a lot of different fillers that we can use in the penis to achieve a certain look or to achieve a certain feel. And the best part about these fillers is that you can build on top of them. So say you want to come in and you want a little bit of enhancement just because you're nervous, you don't know what to expect, you don't know what goes into the process. Well, the first injection, we can do a certain amount of filler. Well, guess what? After that filler settles in about 2 weeks, if you want more, we can build on top of what you already have. I kind of phrase like fillers are kind of like Legos. You can build them on top of each other to where you want to go. So I have some patients that come in, they do their initial injection, and they're like, oh my God, this is fantastic. I love the results. I want more. Well, guess what? In 2 weeks, we can do just the same amount of fillers to get an even bigger result. And then if you want to add in the Bellafill on top of that, the results are going to be longer lasting. Now with Bellafill, we do mix the injection with HA fillers. This is because we achieve better results this way. We achieve smoother results because granted, even though we want to increase the size of the penis, we want to make sure it actually looks aesthetically pleasing as well. We don't want people to know that you've gotten fillers in your penis, and you probably don't want people to know either. But that's another reason why HA fillers are perfect. If you slowly build to where you want to go, it is going to be more smooth. It's going to look better. Because a lot of people have asked me, well, I've gone overseas, I've gone to other doctors, and they want to inject 15 to 20 syringes of filler all at once, so it's more of a one and done treatment. Well, whenever I've seen patients do that, or when I've seen patients come in because they need the filler reversed, it's because they're thicker in areas, it's not even, there's nodules, there's bumps, there's a lot of swelling, and it just doesn't look natural. So I will let you know, slow and steady wins the race. I can't even talk right now. Slow and steady wins the race when it comes to penile enhancement. And it's your penis. It's a really important part of your body. I get it. So the slower you go, the better it is, the better it's going to look, and you can build on top of what you already have. So that's really the beauty of these HA fillers. And it's a non-invasive treatment. You don't have to go underneath the knife. You don't have to worry about loss of sensation. I do get that question all the time. Intercourse is not going to feel different, or at least for you it won't. For your partner, that is a whole nother conversation we can have. But that's one of the better reasons for HA. All right, let's see. I know I've missed a ton of questions, so let me scroll up here. All right, would the head of the penis look smaller? So yes and no. Obviously, it depends on what you're already working with. Not every penis is made the same way. If you do have a smaller head compared to your shaft and you want to increase the girth, you can increase the girth of the shaft, but the head's going to look a little bit smaller. Now, you can inject HA filler into the head of the penis, specifically the corona part of the head. So that's the little rim that goes around the penis head. That is a safe way to enlarge that. However, you don't want to inject HA filler directly into the head because there's a lot of nerve endings, there's a lot of tissue. You don't know what the filler is going to do in there because of that spongy tissue that's in the penis head. So my advice, you can build the corona, you can build the shaft, but other than that, I would not inject a lot of syringes into the head of the penis. What's the name of the procedure? So just penile enhancement, penile enlargement with HA fillers or Bellafill or even fat transfer, which is something we haven't gotten to yet. Let's see, sensitivity changes. Okay, like I said, the sensitivity while you're having sex will not change. Your partner won't be able to tell that anything is different except for the size. It's still going to feel the same, again, when you're flaccid or erect. It's just going to look bigger. How is this any different from the guys who do silicone or saline? Okay, so silicone is definitely a permanent filler. However, there are a lot of complications that can come with silicone. So silicone can be poisonous. It's very dangerous, and Dr. Emer actually doesn't inject silicones into patients unless you are HIV positive or if you are older. And that is for volume in the cheeks specifically. I would not personally inject silicone in the penis because if it is injected incorrectly, if it creates nodules, if it is just in there and it's just not doing what you want to do, guess what? The only way to get that silicone out is through surgery. So that is putting a knife to your penis and pulling it out. So that to me is already, I'm not even interested, because then sensitivity could be affected. Then the look, you're going to have a scar on your penis that can be affected. So that's what happens when people go through more of surgery to enhance the size of their penis. How much is this process? So it really depends on how many fillers you need. Obviously, if you are more well endowed, you're actually going to need more fillers to cover that area. If you're on the smaller side, then you're going to need less. So it really depends on what size your penis is now and where you want to go and what your goals are. So like I said, every penis is made differently. Every guy is made differently. The same filler that's going to work on guy number 1 is not going to be the same that's going to work on guy number 2. So it all depends on, again, it's all based on you. So if you are interested, you can always have a consultation with Dr. Emer. You can have a consultation with myself, and I can go into more detail about what kind of goes into filler. So let's see. Let's look at some other questions. The filler can be used on the balls. So I'm assuming you just want larger balls. Well, in that case, I would actually recommend something called Scrotox. So it relaxes the muscles. It relaxes the scrotum to where the scrotum is... Oh, hold on, guys. I think we have a guest. Let's see.
Hey guys.
Dr. Emer, how are you?
Oh my God, I'm in confinement. It's crazy. But I'm here and I'm ready to discuss how we get bigger penises. What can we do to have that strength and that vitality that everybody is looking for? I know you want to know these details, and Justin is our guy to talk about it.
Dr. Emer, we have so many questions for you.
And guess what? This is not April Fool's, you guys. This is real. This is real, okay? So what are they asking, Justin? Tell me. What are they asking?
So right now we've talked about HA fillers. We've talked about Bellafill. One question I'm getting, though, which I know you know the answer to, is what is the more permanent solution?
Oh my God, everybody wants their penis to be longer and stronger. We know this. Bigger is always better, right? Well, it depends on who you're talking to. But what I have to say is you can do fat injections over time. You know, we sometimes will store fat after we've harvested from the stomach and injected it. Oh, we will talk about PRP. Don't you worry, my love. We will talk about it because we always want that skin and that tissue to be stronger and better. The harder it is, the better the ejaculate and the orgasm. We know that. Everybody wants it, and this is what we're talking about. And John, if you think this is weird, unfollow, my man. This is what everyone's talking about all the time, and this is what people want to know. And you know what? If you're busy, secluding yourself from Corona, let's talk about what we can do to have a lot of babies produced in the next 9 months. You know what I mean? So we can use fat. We can use Bellafill injections, which is a long-term filler used in small quantities. However, outside the United States, it is used in large quantities and can cause lumps and bumps. So you want to go to someone experienced. Just so you guys know, it's so funny, everyone's saying, is this an April Fool's? No, it's not. We're talking about it for real. And yes, we look good because we've all been doing peels. Show that skin. Look at that. We've all been doing peels. I'll be doing an enlightened peel in the next week or so you guys can see what it's like. But with that said, you guys, there isn't anything that's completely safe for injections to this area. So you have to go to someone experienced. With the HA fillers, you can get some swelling. You can get some what we call the ring effect, where one area is a little bit thicker than another. You have to trust the doctor, go back and do injections over time. Sometimes little touch-ups are needed. And especially with Bellafill, small micro droplet injections, we'll mix it together with the HA. What do we call that, you guys? That's the Bella Lift and the Bella Sculpt procedure on our YouTube, so check that out. But in general, there isn't anything that's going to make it much, much bigger unless you do an implant. And I wouldn't always suggest an implant. It's just that I think that the filler itself is a good alternative for some people that want it. The more you do, the bigger it will get. But there's only so much you can do. It's like a balloon. At some point, it will pop. So you can only do so much. You know what I'm saying? What else are they asking, Justin?
So I'm reading through some of the comments, and a lot of people are asking about how much it costs. You know, how do you determine which filler is right for a person?
Well, so let's talk about the cost, you guys. This isn't a cheap procedure, and it's not something that I claim to be cheap, and it also isn't perfect. Some people will get swelling. Some people will get lumps or bumps that would either have to be reversed or camouflaged with more filler. It's one of those things we talk about at the beginning. If you're going to do this procedure, you have to be prepared for that, and you can't get upset if those things happen, but we can build slowly over time using the filler, and fillers can range on average depending on who does it, but in experienced hands like me, between $750 and $1,500 a syringe, and you could be doing 8 to 10 syringes of treatment. So it could be very expensive, just like Sculptra is for the butt, but it's something that makes someone happy. If it really makes them happy, then we do it. We'll often combine that with the Scrotox. I know they're asking all about it. I can't wait. I know, look at Gene from Philly says he really desperately needs this treatment. So we can do it for you when we reopen, Gene, no problem. But Scrotox is another treatment that we can do to drop the balls, to make it less sweaty, to help people have a little bit softer, less wrinkly looking ball sack. We don't usually do fillers in there because I don't like the look of it, but you can. Some doctors do fat injections and filler, HA filler injections to the scrotum. I would say don't do that because your little baby producers are in there, and we don't want to mess those guys up. So I wouldn't do that. And thank you so much, you guys. We love Nutella, and we love our skin. Thank you so much. Everyone's saying all about our skin. They love your skin, Justin. They think you look 15.
It's because I just did a
Hi, Fernando. We love you. Eat Naked LA, you guys. One of our favorite food delivery services in Los Angeles. I've been getting it to get more ripped. I could show you guys. I've been working out a lot. Got my six-pack going. You can see my chest is getting defined. So I'm on keto right now. But let's talk more. What else are they asking about penis injections? PRP. Tell them about PRP a little bit, Justin. What do we do this for?
All right. So when we talk about PRP and A-Cell, we are specifically talking about the P shot. And this is where we can help rebuild blood vessels in the penis. You can get harder erections. You can last longer. This is all about sexual wellness. And this is something, as Dr. Emer says, it is a commitment. So when we do this injection, do it once a week or once a month for 3 consecutive months. That's the best way to kind of rebuild. It's great for men who are experiencing erectile dysfunction, or if you just are looking for a larger sexual appetite, this is a great treatment to do. It's super simple. You come in, we draw the blood, we put it in a centrifuge, we spin it, we put in the platelet-rich plasma, that's what PRP stands for. We inject it directly into the penis.
So let me talk to you guys about that. So first, let me just go up. If you guys are looking to do peels at home, because people are asking about it right now, emeragecosmetics.com. Go to Enlighten Peel or Cosmolon Peel. We'll do a virtual application with you, and we'll send it to you. You can peel at home right now, emeragecosmetics.com. Now, let me tell you, number one, toxin to the scrotum doesn't do anything to the balls or the penis. We're fine. You're going to be fine. The filler, like I said, can have little lumps or bumps and some swelling. You have to work with me to get that fixed up. Now, PRP is injected into the tissue to make the tissue have more longevity, to have more strength, to have more vitality. As you age, you guys, you know what happens to the skin on the face. You get blood vessel dilation. The skin becomes thinner. The same thing happens to the balls. The same thing happens to the penis. We need the penis to really be strong. We want our men to have really great, erections and be happy and have great orgasms and happy during sex. And the same thing with our women. We can do the shot into the vaginal area, to the labia, the G-spot, and the clitoris. So you might as well, benefit from that. You know what I mean? And what are they saying here? No, lemon scrubs do not help. I would go towards lemon scrubs. Now, someone's asking about exosomes. So let's talk about exosomes being our highest MSCs, which are our stem cells. However, much more expensive and not as well studied. So we don't know yet if that's going to be something that's going to be the best for that area. But I would use it as a last resort right now. We do it frequently, though. I will tell you, I've had many people do exosome therapy and then have 4 or 5 orgasms that night. So you never know what can happen. And some people are doing PRP injections just as anti-aging. They're just doing this consistently on a regular basis. So 1 to 3 treatments in a row monthly, and then every quarter, so that we can really keep you looking and feeling good and having more babies if you want, or just better sex, whatever it is you need. So what else are they asking, guys? What else should we be talking about?
So someone brought up penis pumps, and I know
Talk to
during our
them about it.
consultations we get so many questions about penis pumps. So this is a really great way. It's a really good at-home treatment, and it really depends on what type of penis pump is going to work for you. There's water-based penis pumps, and then there are air-based penis pumps. And what they do is it enhances the size of your penis. It is something that you have to commit to. You do have to do it every day. It's just like going to the gym. Guys, anything with skin, with sexual enhancement, with penile enhancement, everything is based on consistency. To get good results is consistency. I know Dr. Emer really talks about that with all of his patients. It's really important. But with the penis pump, if you do a penis pump in tandem with fillers, you're going to get a better result. And
Exactly.
you can do them in tandem. You can do them together. I tell all my patients you can pump for 10 to 15 minutes a day. Like I said, everyone's different. Things are going to work differently for different people, but find what works best for you. And it's actually going to help the filler settle in, and it's going to help Dr. Emer be able to put more filler into your penis if you do pump.
Exactly. So we have a full down under rejuvenation treatment combination. If you want to be thicker, we do fillers, fat, or Bellafill. If you guys want to have better erections and just a better sex life, PRP, stem cell therapy, or exosomes. If you want your balls to hang a little lower or you want less sweating in that area, Scrotox it up every quarter so that we can really keep you looking and feeling good and having more babies if you want, or just better sex, whatever it is you need.
So someone brought up penis pumps, and I know
Talk to
during our
them about it.
consultations we get so many questions about penis pumps. So this is a really great way. It's a really good at-home treatment, and it really depends on what type of penis pump is going to work for you. There's water-based penis pumps, and then there are air-based penis pumps. And what they do is it enhances the size of your penis. It is something that you have to commit to. You do have to do it every day. It's just like going to the gym. Guys, anything with skin, with sexual enhancement, with penile enhancement, everything is based on consistency. To get good results is consistency. I know Dr. Emer really talks about that with all of his patients. It's really important. But with the penis pump, if you do a penis pump in tandem with fillers, you're going to get a better result. And
Exactly.
you can do them in tandem. You can do them together. I tell all my patients you can pump for 10 to 15 minutes a day. Like I said, everyone's different. Things are going to work differently for different people, but find what works best for you. And it's actually going to help the filler settle in, and it's going to help Dr. Emer be able to put more filler into your penis if you do pump.
Exactly. So we have a full down under rejuvenation treatment combination. If you want to be thicker, we do fillers, fat, or Bellafill. if you guys want to have better erections and just a better sex life, PRP, stem cell therapy, or exosomes. If you want your balls to hang a little lower or you want less sweating in that area, Scrotox it up. And also remember, you could lipo the area. We could do mons pubis lipo or pelvic lifts. And whoever said Dom Top was me, you guys. You know, we gotta this is Corona. We have no time to mess around here. I know, I'm a little daddy right now, I know. And Justin's like a little baby over there. So this is what I'm saying is this whole combination is where we're going, guys. We're going towards this full male and female rejuvenation. People really want these treatments now. They're asking for them. They're stuck inside right now. What are they doing? They're eating and having sex. That's what they're doing. They're watching Netflix. So you want the best, sex life. You got to keep it that way. Remember, the balls and the penis, they age just like the rest of your face and your body. And so we can do rejuvenation treatments, we can do cosmetic treatments, and we can just, give you what it is you're looking for. So what else? You guys want to keep asking? What are we talking about here?
So I think a lot of people are just surprised that there is a way to enhance the penis because, it's a newer procedure. It's with your techniques, it's working really well. And a lot of men are very excited. We have a lot of patients that come in once a month just to build and build and build and build.
Yeah, I mean, we have some patients with over 40 syringes of filler, giving them about 2 to 3 inches around in girth, going from a 5 to a 7 around. It's pretty big. We call that beer can, you guys, beer can. Let's talk about, what's that website, urbandictionary.com. I feel like our comment section right now is urbandictionary.com. Don't you guys think? It's hilarious. I love it. So we're getting to a new level. This is how our patients feel about us. And this is something that we wanted to do on April 1st because this is not an April Fool's. This is real life. And Quarren Daddy here right now is going to talk to you about everything you need male. And so we do a lot of male high-def sculpting, but you guys know we can take that fat and we can inject it to the penis. We could sculpt the area around. The other thing we didn't talk about is laser hair removal and pigment. Let's talk about that because we have a lot of people ask us about the penis, the anus, the area between, which we call the taint, all those areas. Can we do peels on those? Can we do lasers on those, Justin?
So of course we can. We can do that. So I know if you've listened to Lindsay and her live or some of the other posts we made, we talk about the Enlighten peel and the Cosmolon peel. Both of these peels attack pigment, they even out skin tone, and guess what? You can do them on any part of your body. So you can do it on the penis, you can do it on the butt. Yes, you can do it on the vagina. You can literally do it everywhere. It is a 2-week peel. It lifts up that pigment, and then everything's more even keeled. And then if you want to do a little bit of light lasers, like if you want to do some aerolase for some hair removal, we can easily do it.
And that's the thing is, so that people are asking right now, one, if I'm going gray, I am because of all this corona stress. Number 2 is they're asking, can you treat the pigmentation down under, which Justin just talked about using Enlighten and Cosmolon peels, and then going into a maintenance plan. In the maintenance plan, we could do things like Vivacia foam, Cosmolon 2, vitamin C, kojic acid like a Phyto Plus. So I'm going to talk about that as we do some Emer chats coming up in the future on emeragecosmetics.com. You can get all these treatments. You can email Justin directly. He will get you information on all the products that you can do right now at home. You can do down under peels right now at home if you want, and or the products. But like he was saying, and my favorite thing to talk about, we need to send this to the company, Aerolase is a microsecond YAG laser. What does that mean? Microsecond means it doesn't burn the surface of the skin, you guys. So it's safe in the genital area. So you can do these treatments. You can do these treatments. I love these comments. It's so good.
I'm dying.
The comments are, I'm telling you, this is Corona life, guys. Corona life. So you can do microsecond YAG laser so it won't burn the surface. You can do this with dark skin. You want to treat your anus. You want to treat your balls. You want to treat in between. We have so many people that want that area nice and smooth. So we can also, when you remove hair, it decreases sweating. Someone asked about acne on the butt. We can get rid of acne on the butt, do a peel, you could do a Botox in that area. You could do aerolase in that area. There's so many combinations. So Justin's going to go live again soon to talk more about these down under treatments. And as you guys know, this male rejuvenation is not an April Fool's. This is what people want, you guys. It's really important to talk about. And so that whole male rejuvenation, when you come in or you do a virtual consult, we don't just talk about the size. We talk about the strength. We talk about your long-term plan. We talk about the pigment, the hair. If you want your whole body to look good, why not have your down under area looking good too? Heidi in Closet, we love you. Where have you been? We've been waiting for you to talk about penis filler. Why have you not been here until now? This is wild. What else, Justin? What else should we tell people as we finish up? We're getting close to the end here.
Right. So it looks like there's a ton of questions about what exactly the downtime is with penis filler. Are there any contradictions? Are there any restrictions?
Okay, so let me do one thing really quick. Heidi in Closet, you guys all go follow her, my fave in Atlanta. So beautiful. Soft and supple skin after doing Botox on the skin, you guys. So we just talked about Botox on the scrotum. Heidi in Closet did that on her face, and it looks so beautiful. Minimal downtime for that. Minimal downtime for PRP injections or topical PRP to the skin. A couple days of swelling and bruising with penis filler, 1 week to 2 weeks, no sex or masturbation in that area. It's so funny. I'll tell you guys in a second. No sex or masturbation in that area. And after about 2 or 3 weeks, we reassess if we need to do little touch-ups or not. And just so you guys know, I'm not going to show you my work in that area. Okay? Can't do that on Instagram. We can only do that on OnlyFans. Okay? So someone's asking for Corn Daddy, how long until I can get busy? Well, we just talked about that. 1 to 2 weeks, no masturbation or sex. And we need to, and you guys, during quarantine, we can't do these treatments. But we can do, oh my God. Oh, yeah, Justin's really cute, you guys. Look at his skin. He just did a Rev peel. So if you guys want to get your skin looking good, start talking to Justin. He will send you the regimen of exactly what we need to do. But most people, I would tell them 2 to 3 weeks back at normal activities when it comes to sex, and minutes to hours after PRP, aerolase, Botox, soft and supple, Heidi's soft and supple treatment. But that's really it, you guys. So stay tuned for more in this next week. We're going to keep going live to talk about the things that you guys want to know. You know that. And Spiky Red, you need to contact Justin because he will get you that glow and go treatment. Whatever you need, that glow and go treatment. He will totally get that for you. Justin, tell us about what you're doing right now on your skin because it's looking flawless.
Oh, well, since I have all this time at home, I've really just dug through all my cabinets, which I have a ton of skincare, and it really depends on how my skin's presenting. I have acne-prone skin, so I have to exfoliate my skin every single day. So one of the products that I absolutely love is the Skin Zyme.
Oh, I love Skin Zyme. Tell them about it.
It's one of my favorites. It's papaya enzymes. What it does is it eats away all the dead skin. It removes dead skin. It keeps my skin exfoliated because what happens with me is if I don't exfoliate my skin, that dead skin gets in the pores, and then guess what that happens when those pores get clogged? Acne. I'm 28. I'm going to be turning 29 in 11 days. So happy quarantine birthday to me.
Let's have a quarantine birthday live with you. That would be great.
But I still get acne even at this adult age, and it's a problem that a lot of people are facing. But if you get put on the right skincare, if you do the right maintenance, you can really help control it. So
and that's the thing. That's why you do your peels every 3 or 4 months, which now is a perfect time. Michael, we love you. How are you, Michael? People are asking if I have OnlyFans. I do not. I'm a medical professional. I cannot have an OnlyFans. We have Emerage Cosmetics and Jason Emer to give you all the up-to-date information you want live. Okay, and just so you guys know, Justin here, who looks about 14, is turning 29. What did you say?
Yeah, 29.
29. So he's got to keep his skin looking great, which is why he's been doing deep peels every 3 or 4 months and doing lasers in between. So you can set up a virtual consult and you can do that with him anytime at emergecosmetics.com. And yeah, Michael, we love you. You're the
Oh, thanks,
man.
Michael.
Justin, everyone's telling you you're so cute. They love you.
Oh, thanks, guys.
So just to highlight it out, you got to continue taking care of yourself. And this is one of those new things that is just trending right now on using treatments to improve the down under area. Fat grafting to that area can range between $5,000 and $10,000. It just depends on what we need to do. If you do lipo with it, it could be a little bit more. If you do storage and we do re-injection, it could be a little bit more. But these treatments can be life-changing for some people and just overall anti-aging. All
Correct.
right, I'm going to
And one
zoom
thing,
out. You spend a few more minutes with everybody, okay?
oh, I
And,
will.
this was great. I look forward to surprising everybody in the next few weeks.
Thanks, Dr. Emer. All right. So there was a lot of questions that were answered. I was reading through a lot of them. Yes, as Daddy Emer is gone. So I had a question. It was, is there a difference if you are circumcised or uncircumcised? And the answer is absolutely. There's a huge difference. There is a difference in injection technique. There is a difference on what fillers we're going to use. And also, some people that are uncircumcised, they are better for fat transfer. So I know we didn't really get into that as much as the HA and the Bellafill. But with a fat transfer, it is a permanent solution. We're injecting fat into the penis. During the surgery, I advise everyone get fat storage because we can freeze the fat, we can store the fat, and then in 3 months, if you want more girth, we can add it to your penis. It's super easy to do. But if you don't store that fat, guess what? You're going to have to go through a whole nother surgery to get more improvement. I think there was another question that I missed. Let me see. Oh, so for skin types, we were talking about Cosmolon and Aerolase and hair removal down under. Yes, it is okay for skin types 1, 2, 3, 4, and 5. So, of course, we do have to be more careful with skin types like, 4 and 5. Aerolase is fine for any type of skin, African American skin, Asian skin, Caucasian skin. You're completely fine. And also that Cosmolon peel, it was specifically made for African American skin, meaning anyone can do it. If you're Indian, again, if you're Asian, if you have sensitive skin, if you have skin that pigments easily, you can do all of these treatments. So obviously it's not going to be the same for everyone, but that's why you can have a consultation. So when you have a consultation with us, we really customize your own treatment plan for what works for you. But if you are interested, please DM Dr. Emer's Instagram. We can get you set up. We can talk about pricing. We can talk about what procedure you're a good candidate for, any of that. So I don't think, let's see, it will open up new door. Yes, it will. So let's go back to that stigma.